Good afternoon, teacher. I will tell you a topic, Ubrogepant for the treatment of migraine. I am Natalie Ventura Torres, and let's start. First, the definition. Migraine is a chronic disease characterized by episodic attacks of headache, sensitivity to light and sound, and nausea. The major class of medication for acute migraine treatment are analgesics, including non-steroidal inflammatory drugs, ergots, and triptans. Ubrogepant, the efficacy of small molecule CGRP receptor antagonists (gepants) for acute migraine treatment has been shown. Ubrogepant is an oral, small molecule calcitonin gene-related peptide receptor antagonist for acute migraine treatment.
I will say United States statistics, 30 to 40 million adult patients with migraines. So 1 in 6 or 1 in 10 American has a migraine one time or more than one time in their lifetime. So headache is just one of the symptoms of the syndrome. So migraine is then comes nausea, vomiting. Some people are very sensitive to light, sound, triggers, all the triggers we have, weather, especially cloudy weather. People have more headaches with it, and it lasts. It's not one of those headaches that you took one Advil or something and got better. It's going to have a lot of, even the headaches get better, they will have a lot of fatigue, lack of concentrations. They are drained at that point. So that part lasts longer than even a headache sometimes. It's very important for doctors, whether primary care or neurologists, to eliminate other causes of headaches, or if a patient comes directly to see you. It's very crucial that we are not dealing with anything else triggering the headache. So sometimes we do some investigations before we label them migraines. Each person's migraine can have little variations. There are different kinds of migraine, including that can present like stroke-like symptoms. So they can have sensory symptoms, or they can have some tingling, numbness, or weakness. So they can look just like a stroke, speech problem, and they usually come to the ER, so we make sure that we eliminate other causes. So even types of migraine and the therapy we choose also helps us. If they have any cardiac issues, they have depressions, we choose different drug then. So it helps us. There are other medical issues.
Applications in medicine. Recommendations for Ubrogepant. It is the first drug in the class of oral CGRP antagonists approved for the acute treatment of migraine. The recommended dosage of oral Ubrogepant is 50 mg or 100 mg taken as needed without regard to food. A second dose may be administered at least 2 hours after the initial dose if needed, with a maximum dose in a 24 hours period of 200 mg. In patients with several hepatic or renal impairment, the recommended dose is 50 mg. A second dose may be administered at least 2 hours after the initial dose if needed.
Options that are safe and effective for patients to take when they're having a migraine attack, and options that potentially aren't going to cause any kind of long-term harm, and also can be used by patients hopefully frequently without concern for things like medication overuse headache. So at this meeting we're talking a lot about some of the CGRP antagonists, and Ubrogepant is one of them, and I'm presenting some posters, one particularly looking at long-term safety of Ubrogepant. And these are patients who were in a trial after completing the primary trials, Achieve 1 and Achieve 2, could choose to stay on for a year and use intermittent doses of Ubrogepant, up to 8 doses in a month. And we were looking to see, one, long-term was it safe, and two, long-term, if these patients had efficacy, was it a continued efficacious medication? This showed efficacy over time. It didn't just work and then stop working. And so these posters discussed that it was safe in the long term. There was no big safety signals that were seen with frequent use during a month, and the average use was about 2 doses a month, but they were some patients who were using almost up to 8 doses in a given month, and they were using, on the average about 38 to 40 doses in a given year. And we didn't see any big signals that were concerning. So that was really reassuring to me as a clinician and as a migraine expert, but I would hope this is also reassuring to our providers out there who are prescribing a lot of medications for acute treatment, to know that this is a drug that can be used safe over time. We also have data that shows that it is efficacious long term. So when patients are using it, that the data is similar month to month over a year time period. And I think that's another important thing. My patients want to know, if I take a medicine and it works, is it going to keep working, or is it going to give up on me in a year? So this data, I think, is a really important set of information to have for clinicians, to know that they can feel confident when prescribing an acute treatment that it has good long-term data. Can we see certain groups that seem to respond really well to Ubrogepant, for example, compared to not responding to Ubrogepant? And so far, we haven't been able to see too much of this, but to be honest, I don't think they've delved at this point too deep into that information. There's some abstracts being presented showing that people who have used triptans in the past and aren't responding, or it was ineffective, or they were ineligible, they had risk factors for use of it, that they did respond to medications like Ubrogepant. So I think that that's interesting information that's really important. I want to know, if I have a patient who's failed sumatriptan, which I consider one of the standards for migraine acute treatment, that if I give them a medication like Ubrogepant, that this is going to be effective, that they have a chance of working. So there's some data that surrounds that as well.
Pros and cons. Pros. Analysis of Achieve-2 suggests that the oral CGRP antagonist for an allergen provides significant pain freedom and relief of the most bothersome symptoms for adults with migraine for at least one dose assist. Some patients have freedom from the most bothersome symptom at 2 hours with 100 mg Ubrogepant. Cons. The most commonly reported adverse events were nausea, somnolence, and dry mouth. Adverse events within 48 hours after the initial or optional second dose with the 100 mg Ubrogepant. Serious adverse events reported within 30 days in the Ubrogepant groups included appendicitis, spontaneous abortion, pericardial effusion, and seizure. None of these events occurred within 48 hours after the dose.
Does have a migraine, I do encourage them to get care from their provider, their physician, because they might be able to get treatments that are very effective and very quick. There are some over-the-counter medicines that can be quite effective, such as some of the anti-inflammatory medicines like naproxen is an example, which works really well in the right situation. Naproxen comes in a liquid gel formulation that's faster than a regular tablet, so if someone's going to use an over-the-counter medicine, we typically recommend that medicine. There are some combination medicines that include caffeine and acetaminophen. We know those as Excedrin and medicines like Excedrin, and those are also really effective for rare episodes of migraine. If someone starts having frequent headaches, meaning more than 2 headaches in a week, you really should be seeing a physician about that, because the same medicines I just mentioned, either the liquid gel naproxens or using medicines that have caffeine and acetaminophen like Excedrin, if you take them too often, they actually irritate headache pattern and make you have more frequent and more intense headache. Something we call medication overuse headache, or also known by its street term as rebound headache. And so people get into that trap because they're uncomfortable. They have to use these medicines because they make them feel better within about an hour or so. But if they have recurrent headache and they keep taking those medicines, it irritates our nervous system, making the next headache more severe and more likely to happen with little stimulus.
Well, do you know your migraine? There are several types, and each has different symptoms. A migraine without an aura causes severe pain on one side of the head. A migraine with aura causes severe pain with wavy lines and flashing lights. A migraine aura without a headache causes only wavy lines and flashing lights. An ophthalmoplegic migraine creates a severe headache in the eye region. A hemiplegic migraine causes severe weakness or paralysis on one side of the body, and a vestibular migraine causes dizziness and vertigo.
Issue applied in Ecuador. In Ecuador, this drug was approved for FDA. In Ecuador, it is used, but it is too expensive. The Ubrogepant, despite being still in phase 3 of clinical trial, has shown good results. The agency need to determine the durability and safety of Ubrogepant for acute migraine treatment and to compare it with other drugs for migraine.
I think the oral Gepants are going to really serve to meet an unmet need. And specifically what I mean by that is we have the triptans, and they've been great for a number of patients, but there's definitely some problems. And I'll kind of categorize it into 3 ways. Number 1, there's patients for whom the triptans are contraindicated because of cardiovascular issues. But number 2, some patients are on the triptans and there's just lack of efficacy. I have patients that have tried multiple triptans and they just don't work that well. And thirdly, some people don't tolerate the triptans. When I talk about the triptans, the most common is sumatriptan. And we know with triptans you can get things like flushing, chest tightness, neck tightness. So I find that many of my patients delay treatment, or they'll actually say that heck has got to be over the top before they're going to suffer the side effect of the triptan. The clinical studies that I've seen with both Ubrogepant and Ubrogepant, which are both oral CGRP antagonists, it appears that they have no cardiovascular issues. And we're now finishing, many clinical trials. We have thousands of patients in the trials. And furthermore, they seem to be very well tolerated. If you look at the clinical trials and the AE, the adverse events, we're not seeing the flushing, the chest tightness, the neck tightness. And we're also seeing some pretty good efficacy when you look at things like 2-hour pain relief, relief of most bothersome symptoms. So it appears that the oral Gepants could be as efficacious as the triptans, but with a much more favorable side effect.
Conclusion. Some patients who receive Ubrogepant than of those who receive placebo have freedom from pain and absence of the most bothersome symptom at 2 hours after the dose. The most commonly reported adverse events were nausea, somnolence, and dry mouth. Thanks for your attention.